The Health and Human Services Committee is now called to order. Please call the roll.
Alderwoman Gracia. Alderwoman Spencer.
Present.
Alderwoman Tyus. Alderwoman Green.
Present.
Alderwoman Martin. Alderwoman Navarro.
Present.
Alderwoman Middlebrook. Alderwoman Rice. Alderman Todd.
Present.
Chairman Ornowitz.
Present.
6 present, you have quorum.
Okay. I do believe we have some excused aldermen today. Sarah Martin was excused, as well as Annie Rice. And with that, we have minutes from our Wednesday, November 13th meeting. We'll entertain a motion to approve the meeting minutes from November 13th.
So moved.
Second. Okay, please call the roll.
Alderwoman Gracia.
Aye.
Alderwoman Spencer.
Aye.
Alderwoman Tyus. Alderwoman Green.
Aye.
Alderwoman Martin. Alderwoman Navarro.
Aye.
Alderwoman Middlebrook. Alderwoman Rice. Alderman Todd.
Present.
And Chairman Ornowitz.
Aye.
Alderman,
That's 1 present and 5 aye votes.
Alderman Todd would like to change his vote to aye.
That is 6 aye votes.
And with that, we have no board bills for review and no resolutions, but today we are going to be hearing a discussion with Dr. Echols, the Director of Health, the City Health Department, as well as stakeholder in the public health sector, A.J. Bockelman. And with that, I'd like to invite Dr. Echols to come and maybe introduce our presentation for today.
Absolutely.
Dr. Echols, thank you for joining us.
Thank you. Thank you all for convening this meeting to hear about a very important health issue that's impacting health outcomes for the city of St. Louis. I'm not sure if you all are aware of the County Health Rankings report that was issued earlier this year by the Robert Wood Johnson Foundation. Just to put things into proper context, when we look at health outcomes for the state of Missouri, particularly based on county rankings. So in the state of Missouri, there are 115 counties. When we look at health outcomes, according to this report, the city of St. Louis ranks 112th out of 115. For length of life, we rank 112th out of 115. For quality of life, we rank 112th out of 115. For health factors, we rank 113th out of 115. For health behaviors, we rank 112th out of 115. And for social and economic factors, we rank 115th out of 115. So these are very dire statistics. As you all know, the mission and the vision for the health department is really for us to achieve an equitable community so that individuals across the community, regardless of their economic and social status, they're able to achieve optimal health. And so far, based on these statistics, we haven't really done our due diligence. And so we're really taking a more proactive approach. And one of the ways that we can do that is by not only making sure that their services are available, but making sure individuals can take advantage of those services. So if you're familiar with the most current census data, if I recall correctly, over roughly 25% of individuals within the city of St. Louis are living at or below the federal poverty level. And so that speaks to, again, a significant percentage of our population that may not have access to quality medical services. And so one way that other states have been able to do this is by expanding Medicaid. Missouri to date is one of 14 states in the United States that has not expanded Medicaid. And again, this puts us in a position where we're actually creating barriers for individuals to be able to access care and improve their health outcomes. And so today we're going to have one of our subject matter experts who is also a really great partner for the health department, Mr. A.J. Bockelman, who is also representative for Healthcare for Missouri. And so we're going to ask you to, or charge you, if you will, with a couple of things during this presentation. One, really take the numbers to heart. So don't just listen to the numbers as numbers, but these are actually lives that are impacted by stances that have been made by government across the state of Missouri. But also think about ways that you can actually help in this initiative so that Medicaid can be expanded in the state of Missouri.
Got a few handouts for. Hi, good morning. Thank you very much. First, thank you to Dr. Echols for inviting us here today. As he indicated, I'm AJ Bockelman. I'm the campaign director for Healthcare for Missouri, which is the ballot initiative to expand Medicaid in the state. As you know, the state has been wrestling with this for over 10 years. After lack of action from the legislature, the will of the people needs to be decided. We're putting this before the voters, November 3rd likely. We're currently in the campaign to get 172,000 signatures from 6 of the 8 congressional districts to qualify. Over the next several months, you're going to see this campaign ramp up. There's some key elements that I've shared in the document that you have before you about the effort to expand Medicaid. Currently, we believe that over 200,000 individuals do lack health care, and this would extend it to over 200,000. Some estimates have actually put this as high as 300,000 individuals in our state. Currently, individuals working part-time at a job, unable to qualify for health care elsewhere, don't meet that financial threshold, or even those who are working a job but fall outside of the qualifying level currently, don't have access to health care. This would allow for individuals making less than $18,000 a year to qualify for Medicaid, and families of 4 making less than $24,000 a year. That's 133% of the federal poverty level. We also know that of the 36 states that have expanded, they're drawing down the tax dollars that their citizens already pay into the federal government. In Missouri, we would bring back over $1 billion in taxes back to our state to reinvest within our healthcare infrastructure and the betterment of our citizens. We have already seen the impacts of that. 14 hospitals throughout the state, including 9 rural hospitals, have actually closed because of lack of action. Many parts of our state, people actually have to travel over 200 miles to get to care. If you talk with any of the representatives from Children's Hospital or from Cardinal Glennon, you'll find that many people are coming from around the state for the care in our major cities because they don't have access to basic care within their local communities in many parts of the state. We know that the voters in the state are highly supportive of this. We are running a nonpartisan campaign. We are working actively now to encourage groups such as the Board of Aldermen of the City of St. Louis to endorse the campaign. Early next year, we intend to release a list of endorsements. This campaign is led by a number of the groups in the state, such as Missouri Hospital Association, Missouri Primary Care Association. The MOVE Collaborative is our grassroots partner helping to collect some of the signatures around the state. That includes groups like Jobs with Justice, Planned Parenthood, many other partners within the state that operate grassroots activities. Let me pause there and just see first if there are any questions from the committee.
Thank you. We'll go down the list here. Alderwoman Ingracia.
It's nice to see you. Thanks for spending some time with us today on what is clearly a super disturbing set of data. What is the best way for us to be able to help you make sure this happens?
So we would love to see a resolution passed by the Board of Aldermen in support of the expansion. We will be going before the voters likely November 3rd. We'll qualify for the ballot. We need to turn in signatures by May 3rd. So you're going to be seeing a number of different activities from the campaign over the next several months. As far as other assistance that individuals or groups can offer, everyone is a part of different communities that care about this issue. So we encourage individuals and organizations to reach out within their networks. Some of our hospital partners are actually working with their vendors to help push this. Many of our community partners, so if you're a member of a faith community, we ask you to ask your local church or other faith entity to endorse. We ask you to consider your group of friends, the community associations that you belong to, neighborhood associations. We want to have this as deep and broad across the state as possible. Part of the reason why we haven't listed endorsements as yet is because I'm working to shore up a lot of rural and outstate support for the initiative.
Okay, well, I'd be happy to take documents to have people sign up to all of the community events that I go to. And if you have draft language for a resolution, I'm sure we can get that introduced here, and I can't imagine we would have issue passing it.
I greatly expect that we should be able to find a lot of support within the Board of Aldermen.
Okay.
I'm happy to supply that information both for more background information as well as language. I'll be honest, I'll probably pull it from what was passed in another part of the state.
No, that's
So you
perfect.
can amend that to whatever you see fit for the city of St. Louis.
Okay, all right, thank you again for being here.
Sure, thank you.
Alderwoman Green?
Just a quick question, maybe you could shine light on it. We're seeing a lot of news media around the fact that 100,000 kids have been recently kicked off of Medicaid, and there's doesn't seem to be a good answer that we're getting for the reason that that has happened. What will Medicaid expansion, how will that be able to help, I guess, that service gap when we're seeing folks that historically have qualified who are now suddenly not qualifying and not getting those benefits?
So the issues going on currently with Medicaid is more about the administration side of it, and those are being addressed through other means. As far as the campaign goes and Medicaid overall, this would be supportive for 18,000 more parents within the state.
Okay.
It raises that federal poverty level. So many individuals who are working, as we know, people on any type of assistance typically are working, but they don't hit a threshold to be able to qualify for these benefits. So they're caught in a cycle. They have to make a decision between feeding their family and taking care of health.
Right.
And that's a difficult decision for anyone to be in, no matter what your economic income. We know that this will impact those families greatly. The current issue with Medicaid, the administration of it, that is a separate issue that this
Okay.
would not directly address.
Okay.
We did make the choice to make this a constitutional amendment so that it has more force within the law.
Then it's a lot harder to mess with the administration of the program, I would assume.
Yes.
Okay, thank you. No further questions.
Alderwoman Navarro?
Thank you. I'm curious, who is opposed to expanding Medicaid and who's organizing any sort of opposition to this?
So currently, we haven't seen organized opposition. We're planning the campaign as if we will expect to see organized opposition. It'd be naive to think that we wouldn't. You have the classic groups that have rumbled about it, small government type focus, the idea of perpetuating welfare state statements, things like that. Those groups are rumbling, but we have not seen any active opposition as yet. We will run this campaign, though, as though we expect to see full opposition.
Thank you. Well, I'm very supportive. We've already had some folks come to the 28th Ward to speak on how they can get involved, so
Excellent.
please keep me in the loop. Thank you
Certainly
for all
will.
your work.
Thank you.
Alderman Todd?
When Medicaid is expanded, do the clients get, have an opportunity to get prescription drugs?
So Medicaid also covers access to whatever additional care they need. That would be coverage of certain drug types. The specific details, I don't know off the top of my head. Perhaps, I don't know if Dr. Echols can speak more directly to the prescription drug issues. But Medicaid typically is covering the care and also the maintenance of their health. So it's much more proactive about access to diabetes drugs, things like that.
Are they allowed to go to any hospital that gets federal funds, the people on Medicaid?
I'm sorry?
Are they allowed, the people on Medicaid, are they allowed to go to any hospital the same as people on Medicare?
Yes.
Okay.
Any more questions?
No, I
Alderman
don't
Todd?
have any more, thank you.
Chairman Arnowitz?
Thank you, Mr. Bockelman. He used to be one of my farmer constituents, and he left me to go to greener pastures. But I've always enjoyed it.
No greener pasta. I'm on the hill.
I've always enjoyed his presence in my neighborhood. No, I think this is great. I think this is something that's probably a long time coming because of our situation in Missouri, and I hope everybody gets it. And we will do our part, and we will, tomorrow is our last day of session till after the first of the year, but we will, this committee will get a resolution, and hopefully we can get it in bank when we're done with it. So I can't think of anybody that wouldn't be supportive of it. So again, we appreciate you doing this. It's going to be a lot of work for you, and let's hope there isn't any opposition against it. But again, thank you. Really appreciate it.
Thank you, Alderman.
I believe we have a follow-up question from the Alderwoman from the 6th.
Thanks. I'm not sure if you can speak to this, but I'm curious if anyone tracks urgent care centers that refuse to accept Medicaid patients. That's popped up in some of the neighborhoods I represent, especially with Total Access Healthcare, which is providing a pretty phenomenal level of service, but they do not take Medicaid patients.
I am not familiar with that issue, so
Okay.
I'm not able to talk to
Okay,
it directly.
all right. That's all, thank you.
Thank you, Mr. Bockelman. We really do appreciate you coming down here today and to talk to us about this incredibly important initiative. I echo my colleague from the 6th desire to help gather signatures and help the effort. So let us know how to help with that. I do have a couple of questions. I share concerns about Total Access and other urgent care facilities that don't accept Medicaid. I think this is something we need to take a look at. If this is something maybe Dr. Echols and we can coordinate, kind of at least looking at the city in those facilities. The 14 other states you mentioned that currently do not have Medicaid expansion. Do you know, are those other states considering similar ballot initiatives or other mechanisms through which to expand Medicaid?
So within the last year, 2018, we saw 3 states extend. That I believe was Nebraska, Utah, and Idaho. Mm-hmm. So not necessarily blue states, generally red states. The 14 states left typically, I believe, mostly are red states. I know Florida has had an active court case around this, about the expansion. They're waiting for clarity there before they can choose to go to the ballot. And I believe at least 2 other states that off the top of my head I'm not recalling are also considering taking it to the ballot. Missouri is one of the 6 states, I believe, that actually has a ballot initiative process. The other 8 do not have a ballot initiative process available to them.
Oh my goodness, okay. Well, that's good for Missouri. The federal funds that are left on the table by not expanding Medicaid, can you just, do you have an estimate of what Missouri is leaving on the table on an annual basis by not expanding Medicaid, or what this will bring in to Missouri as far as those federal funds to provide health care to our citizens?
So we are leaving $1 billion plus on the table every single year that it's not drawn down. Those are funds that the state taxpayer is already paying into the federal government, and it's currently being spent by 36 other states. We also know that Washington University authored a study that shows that because of the investment and the significant outlay that hospitals and care facilities already have for patients who are not able to pay for services or are not getting the preemptive services that are oftentimes required for pre-existing conditions, are causing us a significant cost. Washington University study showed that by 2024, we likely have a savings of more than $934 million. So close to $1 billion there as well.
That's incredible. Would you mind sharing that study with the committee for
Certainly.
our reference? I think that would be very helpful. I'll turn it back to the committee if there are any additional follow-up questions.
No, thank you.
Okay. With that, we really, if you want to, if there's other information that you can share with us, the sample language, I believe the chair of the committee would be the appropriate way to disperse that to the rest of the committee, and any other studies you think might be relevant. I think this is an issue we're all very interested in supporting and learning as much as we can about to make sure that we get a favorable outcome.
Certainly. And Alderwoman Spencer, you are the chair?
I'm the vice chair. Chairman Arnowitz, you could
Arnowitz.
maybe send it to both of us, and that way we can make sure we get it dispersed properly. And we thank you, Dr. Echols, for bringing this to our attention and inviting Mr. Bockelman to come down and present to us today. And with that, with no further questions, I'll entertain a motion for, do we have to move to adjourn?
I don't think we do.
Thank you.
So moved.
Yep. Second?
Second.
Hearing no objections, the Health and Human Services Committee is now adjourned.